This is Chris from the Obstacle Doc, and today we are going to do an exercise that looks specifically at strengthening the tibialis muscle groups that come through to help to strengthen our midfoot, our arch. This is definitely going to be important to the idea of strengthening the foot to support really the whole aspect of it, but especially for patients who have plantar pain, midfoot pain, top of their foot pain, and clinically we note that there's weakness in the foot. We can passively support that with a proper shoe, possibly an orthotic, but ultimately we want to try to strengthen our own self so that our foot can support itself in our walking stride, in our running stride, when we run, when we jump, all that good stuff. So the basic setup is the following. You need an anchor, can be anything. Pick the kettlebell, this could be a regular weight, but something that's gonna hold the band in place so it doesn't follow. Daniela's gonna take her band. She's now gonna wrap it across the front top of the foot, applying tension resistance, and she's gonna step on it with her heel. That's gonna lock that in place. The amount of resistance is gonna be dictated by how tight you pull it and how thick of a gauge of a band you are choosing to use, which oftentimes we will help make that decision for you in the clinic. But again, you can vary the amount of resistance by how much you pull over and anchor down. Once we get situated in place, we're gonna look at the arch from 2 points of view, the ball of the foot at the first knuckle and the heel itself. And we have our arch coming from back to front, front to back. All Daniela is gonna do is keeping her legs straight. She is gonna lift her arch up, trying to stretch the band. And then relax and repeat. What we wanna watch for is that the 2 points stay on the ground. If her toe lifts like this, she's rolling and she's not actually lifting. So you want to try your best to keep the knuckle down and the heel down and avoid any inside-outside sway. Everything stays nice and straight, up and down. Repetition-wise, we can look at anywhere between 10 to 20. It's a pretty wide range, but it really does depend on where you are with this exercise. If you start to develop the pattern as you go, I'd rather you do more repetitions until you kind of get a sense of fatigue where you can't really lift well. Whereas if you stop too early, you might not have got that learning curve going. I would also recommend doing this on your other foot initially early, especially because you're trying to kind of compare and contrast the performance. And if we have a deficit on our side that we're trying to retrain, oftentimes the other foot will do a better job so that you can really understand what you're going for, because you need to have a directive. So if you know what you're looking for, it'll make the exercise more powerful for you because you have an idea of what you're looking for. Finally, for those that can set this up, a mirror, something that you can kind of look at to kind of watch your arch, could be another visual cue to help out to make sure that you're doing it correctly. So you could set this up if you have a portable mirror or a mirror on the wall to actually look at your arch as you're doing it at the same time. This can be done daily, especially if we're trying to re-educate the arch. We would want to do this every single day to build up that learning curve. It can also be done more than once a day, depending on actually how it makes your foot feel, and again, developing those extra reps to get this to do it more proficiently.